Hi, folks, as you're joining us, we'll be getting started soon.
Well, hi, everyone. Welcome. Good afternoon. I hope you're all having a great day. We will just hang on for a couple of minutes while we have more folks trickling in, but just to say that we're thrilled that you're all here to talk with us about presenting on LGBTQ plus health research. This is a discussion being organized by the APHA LGBTQ Health Caucus. And we have some members of the executive committee, as well as some members of the caucus here to talk with us about presenting LGBTQ plus health research, not just at APHA, which is coming up and on lots of people's minds, but more broadly as well. So why don't we get started so we have plenty of time for the panel discussion and then for all of your questions. So I'm Medina Agenor. I'm an assistant professor at the Brown University School of Public Health, and I'm also the program chair for the APHA LGBTQ Health Caucus. And so today we will start by introducing our fabulous panelists who will lead us in thinking about strategies, and will discuss their experiences presenting on their research. So we'll do that first. I do encourage you throughout the panel to put your questions in the chat. And then the second portion of our time together today will be questions from all of you for our panelists, and a chance to kind of engage and also share your own strategies and experiences as well. So if this all sounds good, I will go ahead and introduce our panelists. So first of all, I'd like to introduce Dr. Allegra Gordon, who is an assistant professor at the BU School of Public Health and also secretary for the APHA LGBTQ Health Caucus. So thanks for being here, Allegra. Second, I would like to welcome and introduce Dr. Nicole Van Kim, who is assistant professor at UMass Amherst School of Public Health and Health Sciences, and who has been a friend and colleague to the LGBTQ Health Caucus and many of its members for almost a decade now, I think, Nicole. So thanks so much for being here. And then last but not least, Dr. Erin Guest, who is assistant professor at Arizona State University Edson College of Nursing and Health Innovation, and who is our incoming chair of the caucus, among many other things that Erin does at APHA, many others. So thank you all for being here. It's really great to have a chance to learn more about your work and your experiences. So first, just to kind of get us started, can you tell us a little bit about yourself and really about your experience presenting your research on LGBTQ health? So whoever wants to start.
All right, I can start. First, thanks, Medina, for organizing this first of its kind session, I believe, in the caucus history. And thank you all for joining us for this session. I'm trained as a social epidemiologist. I've been in the public health field for basically most of my career. And I fell in love with public health, actually partially by going to APHA soon after college when I was working as a sexual health counselor. And I just, I went to the Spirit of 1848 session at the American Public Health Association, which for people who go, you might be familiar with it as the social justice and public health session. And then I went to the LGBT caucus sessions, and I was done for. I was like, this is the home for me. I want to keep hearing all this work that people are presenting on. So I've been, that was in 2002. That was in 2002. So that was almost 20 years ago. And I've been presenting my own research since about 2006, when I first presented my master's thesis research at APHA in the LGBT Health Caucus. And the one other thing I'll say about me and presenting is that I've presented quite a bit over the years, but I still get nervous basically every time, including for this webinar. So just putting that out there.
Excellent. Thanks, Allegra. Nicole or Aaron?
I can go next. So I am also trained as an epidemiologist, and I've presented not just like my academic work. Once upon a time, I was also a CDC fellow, and actually my fellowship was very focused on LGBT health. I wrote New Mexico's first LGBT health report back in 2008, 9, something like that. And so as part of that, I actually also presented at a number of public health practice conferences. So this was before, sexual orientation data collection was really like as big as it is now. Like, I know there's still ways to go, but this was like, New Mexico is one of the first states to ask sexual orientation. So it's been really interesting to sort of just be part of that, like getting it on the BRFSS surveys more systematically. And I presented at that conference a lot of the findings from my experience in New Mexico. I presented at the Council for State and Territorial Epidemiologists Conference. So those were like the two big public health practice conferences. Ironically, I've actually never presented myself at APHA. Usually my colleagues have presented at APHA. So, but usually I present at sort of more like conferences where there isn't as much of an LGBT presence. So like Obesity Week, which is part of the Obesity Society, Society for Epidemiologic Research, as well as like just more local public health conferences.
Great. Well, I'll go last, I guess. My name's Aaron Guest, and I am a trained gerontologist with background in public health and social work. So I've kind of, I jump around a bit when it comes to professional identities. I've actually gone in and out of LGBTQ research, believe it or not. When I started it kind of way back in undergrad, I then jumped into what I thought would be sexual health research, and then I kind of I always find myself back, even when I was doing my doctoral training, I was thinking that I was going to primarily focus on rural health, and I ended up focusing on LGBTQ rural health. So, I always find myself, I just keep finding myself coming back to LGBTQ research. I presented in venues where, it's LGBTQ research is new at conferences for professions, for, scientific conferences such as APHA, for community groups, as trainings for individuals who aren't really even familiar with what LGBTQ stands for. And, so kind of the gambit of things, I would say. And I, like Allegra, I am always nervous every time I'm going to a new group. And I feel like I'm always having to reinvent, I'm always reinventing the wheel somehow. I find it never gets easier. It's just, it's not like riding a bike in that regards. But I also think that, like others, I think, I also have the challenge of having to convince people why they care about LGBTQ health, but also why they care about older adult health and rural health. And, I think that's one of the things we all kind of share in common with our research, that even with LGBTQ health is a major issue, but we have to always kind of frame it in whatever we're talking about. But back to you, Medina. Thank you.
Yeah, no, those are really great points, and I hope we get a chance to talk about some of the differences based on the conferences in the audience a little bit more down the line or in the Q&A. So now that we know where everyone is coming from, and we have really a wealth and depth, I should say, of expertise here, can you all share what you've learned over the years? So what are some best practices that you've used when presenting research on LGBTQ health? And I'm thinking both about yourself as a presenter and kind of strategies that you've used for yourself, but also best practices that you found in terms of presenting the work, right? In terms of making sure that your research findings get communicated in the way that you want it to be communicated, and that it kind of resonates with your audience. So if we can address both of those aspects, that would be fantastic. Let's go first, no particular order.
We can go in reverse order this time.
Okay, great.
I think one of the best practices I use is I always think about my audience. If I'm the presentation I give to the LGBTQ Health Caucus or the the LGBTQ Health conference that occurs is very different than one that I might give to a general audience, or like the Gerontology Association, for example. I think there's a base level of knowledge I think we can assume, and I think it's getting better, but I still find myself oftentimes having to define LGBTQ, the difference between sexual identity and gender identity, to really kind of encourage people to understand what we're talking about. I very rarely, unless it's to a specific LGBTQ research audience, assume a base level of knowledge. I do think it's getting better, but I think it also influences how we present our findings. Like, when we're talking about, if we're talking about, gay men, we say that. If we're talking about lesbian women, we say that. If we're talking about bisexual individuals, we say that. It's often, I try to very much avoid using LGBTQ when discussing my findings, because very rarely are my findings applicable to the L, the G, the B, the T, and the Q in that equation. One gap in my research, for example, is I have done very little with transgender older adults, and so I often use LGB or LGBTQ in my research, and then I get things back in like comments on abstract submissions. Well, what about the T? And I think a challenge we have in presenting the research is people assume that you kind of have the full acronym there, but very rarely do I think we're talking about the full acronym and all the identities associated with that. So that's something I'm very careful with in my research, because I would never want to present it being something that it's not. At the same time, I think, one of the things that I encourage people to do, if you can break your findings up into the, to describe lesbian women or gay men or bisexual individuals, that's very important. But if you can't and you're still presenting it, make that clear that, there are differences in these populations that we need to consider. And like I said, I feel like I always, have to tie it back to, when I'm presenting, it's often very much like older adults have these health inequalities. Lesbian and gay individuals have these health inequalities. Rural individuals have these health inequalities, and together, here's what we're looking at. Because people, I hate to say it, but in many settings, particularly community settings, I find myself in, it's often the people like to think of the exceptions they know. Not really focusing on like what the broad swath we're seeing in health inequalities. So I would say that's kind of, one of my best practices, is to be as specific as I can and try to think about my language as much as I can.
Mm-hmm. Mm-hmm. Yeah, great points around specificity and also addressing heterogeneity within the population. Allegra?
Yes. Yes. Well, my first thought was what you've just very nicely laid out, Erin, around thinking about the audience and then thinking about specificity and language. And I would say that I still, even in settings where I'm speaking, say at the LGBTQ Health Caucus at APHA, where I can guess that many people in the room are already well versed in some dimension of LGBTQ health research, I still think it's so important that we define which terms we're using. So like you're saying, Erin, and then we can go into greater depth in an audience that might be unfamiliar, but in any case, the definition and then the acknowledgement that those terms and the ways that people use them vary over time and place, and community setting, geographic setting, that acknowledgement alone is very important to me, that just so that we can try to keep it in mind, because undoubtedly, especially when we're presenting quantitative research, we're going to be grouping and we're going to be sort of obscuring some of that heterogeneity. And so being able to frame things with a reminder to all of us, including me as the presenter, to be bearing that in mind as I go through the findings is a starting point in any case. And then Medina, you were also asking too about kind of best practices for, I think you were also asking about sort of best practices that we use for the presentation style itself. And one of the things that I highly endorse, maybe this is well known, but I'm not sure, is absolutely practicing out loud, not just reading through your notes, but practicing it out loud. And ideally, and we can come to this more later when we talk about sort of the like experiential side, but ideally with a human across from you, an attentive human across from you. It doesn't have to be an expert in the field, but a roommate or a partner or a friend. For this is vital for me. Again, this is not necessary for everybody, but I think this does two things. One is hearing the words out loud, so different than when we think them in our heads or write them out. So being able to kind of troubleshoot just through that kind of auditory experience, if it's a talk that you're giving aloud. And then also the experience of having that attentive human near you helps generate a little bit of that kind of, adrenaline hit that many people get when they're presenting. And it gives you, if you do preparation, you start building a kind of muscle memory for doing the actual talk. So especially if you're somebody like me who gets nervous, or like Erin, this is really valuable, but I think it could be valuable for most people because your body will already have had a little bit of experience going through this talk, which makes for a more kind of fluid time once you're really up on stage. So that's a best practice that I try to use as much as possible, and especially if it's a new talk or something that feels high stakes, or in some other way where I'm worrying myself about the language, I'm really trying to think about the language, then practicing it aloud is so key.
That's great, Allegra. Really good advice. And also, I'm sure you have this in mind, but it can be non-human, right, beings as well. Cats, dogs, you count. I've practiced many a presentation on my dog.
This is a fair point. I thought this through. I feel like it might depend on the pet because
okay.
You're right. Millie, I could imagine would be a great audience. My cat, not so helpful. I don't get that. She just doesn't care. So I just don't get that same hit of adrenaline. So it just depends on your pet.
Got it. Okay. Nicole.
So I definitely echo everything that Erin and Allegra have already shared, and I'm glad they didn't take the one that I was going to talk about as well. But I think sort of in line with both what Erin and Allegra have said, one of the things that I have found really useful in presenting my research to people who don't live inside my head is keeping the message that you're trying to communicate really simple and straightforward. I think, like, I see this a lot with my students also, where and I definitely am very guilty of having done this. I'm sure if I can find old recordings of my presentations, I absolutely did this too. But sometimes we get so hyper-focused on details that might have sucked up a lot of time in our life, but ultimately doesn't actually matter when it comes to the takeaway message that you're trying to communicate with your research. So I think just like really figuring out what's your elevator pitch and what is that clear point that you're trying to make, keeping in mind some of like the challenges with the audience that you are communicating with, and just practicing that and being able to really like, if someone walks away from your presentation, that they have that takeaway, like the so what of whatever your message was. instead of, sometimes getting into the nitty gritty details of your model building, like I'm not going to remember that. I will remember sort of the impact of your research findings, whether it's significant or not. Non-significant findings are still impactful. So I think just really figuring out how to pitch your research in a really simple and accessible way that should be adapted to your audience as well. Like if I ever present at APHA, like my message is going to be very different than when I present to the nutritionists at Obesity Week. And so I think like I can present the same research, but my pitch will be slightly different. So I think just practicing that, getting really familiar with the so what of your area is super important.
That's great. Thanks, Nicole. Yeah, and the setup of the argument might also look different for different audiences. And just to add just two additional points, I think another important kind of thing to think about is how you're contextualizing your findings and making sure that you're highlighting the structural and social factors that may, that are underlying the disparities you're talking about. I think it's very easy to stigmatize populations, even inadvertently. And so situating findings about disparities in societal context and acknowledging the role of broader social and structural forces is really important. As is recognizing both the heterogeneity of the subgroups that we're talking about, right, in terms of race, ethnicity, socioeconomic status, immigrant status, et cetera, and being really mindful of the fact that our findings might not be generalizable to all of the subgroups within that subgroup. And so being very clear about that. And then lastly, just to say, being your own editor, I think is super important. So kind of reading your slides or listening to your talk from the perspective of someone else and thinking, how would someone else receive this, or how would someone else think about what they're reading as you're editing yourself would be very helpful. Okay, excellent. So thanks everyone for sharing the best practices. Now moving maybe to a slightly less fun question, but I think it will still be really helpful. So can you all tell us a little bit about what you found challenging about presenting your research on LGBTQ health? And along with that, it would be great if you could share how you have addressed these challenges. And if you haven't addressed them, how you maybe will do so moving forward. Yeah. Allegra, do you want to start? Or Erin, sorry, go ahead, Erin.
I'll jump in again.
Okay.
I think one of the challenges I often face is, and I kind of alluded to it a bit, is the use of terminology and what terminology to use. I like I said, I work predominantly with older adults, individuals over age 60. And a lot of the terminology we use now is not the terminology, for example, that they rely on. Many times when I'm meeting with people, people we would assume are lesbian will self-identify as gay, or they don't like the term queer. They individuals of different race, ethnicity groups, for example, might be same-sex loving, two-spirit. And so I have to think about that when I'm putting together my presentations. I'm like, how am I going, because I do mixed methods research, how am I going to present their authentic story while also presenting it in such a way that people can understand what I'm talking about? I think very often, unfortunately, we'd like people to fit in these nice little identity boxes, which we know as LGBTQ health researchers don't really exist, in a lot of ways in the real world. And so that's something I think a lot about, is like, how do I present these stories and present these data? And, I'm still struggling sometimes with how to do it. One way I often do it is by, having footnotes in presentations, or having clarifications in tables where I say, like, here are the categories I'm putting people in, but here are actually, here's actually how they self-define themselves. As Allegra said, unfortunately, a lot of the nuance in these, 5 to 10 minute talks, we're not able to get into as much as we want to. We have to save that for the manuscripts and our diaries at night when we're processing everything. And so I still find that to be something of a challenge, particularly when I think, there's increasing work on LGBTQ and aging, but, a lot of it occurs in very siloed arenas. So when I'm presenting it somewhere like APHA and I'm having to think, how do I present this to a public health audience, I have to work through it, because using language such as, the silent generation or rainbow generation might mean something when I'm at an aging conference, means nothing when I'm at APHA. And so that's something I struggle with a lot. I still, I hate to say it, but, I'm very glad we have the LGBTQ Health Caucus. And I'm not just saying that as incoming chair, because it's very hard to find places, I think, to present LGBTQ research at times, because they want to organize, people want to organize panels. And if you're the only one with an LGBTQ research aspect, like maybe you don't fit, or maybe they don't really understand why this is an important issue. I think something you said, Medina, was taken very well, which is, I sometimes feel like when I'm presenting LGBTQ research, people also expect me to be an expert in like race, ethnicity, immigrant status, like all health inequalities. And it's like, no, I have a very, very specific knowledge base over here, that I think it's hard to kind of disconnect from and make people realize, no, like I'm just focusing on this, not all health inequalities. The other challenge, I think, that's a real one that we have to, realize with LGBTQ research is a lot of our work is based on, white people. And that's the reality. A lot of LGBTQ research is based on, predominantly homogeneous samples. We're doing a lot better job. I think there's some large studies, coming out of all your work, for example, but, I always note that when I talk about my rural, research, rural LGBTQ research, it's very hard to find, individuals who are non-white who will participate in it, in part because, it's often unsafe environments. It's also often environments that people don't feel safe coming out in. And so, it's navigating that in your presentations to say like, hey, this work has some real limitations. Like it's still useful, but it has limitations. And I feel like that's something, as researchers, we don't like to talk about limitations, but I think it's critical in our work to say like, these are the gaps we have and we need to address them.
Mm-hmm, mm-hmm. Yeah, absolutely. And also not hiding the fact that if you do have a predominantly white sample, that is a study that will pertain to white people, right? And so not overgeneralizing,
Exactly.
and also recognizing that white and whiteness are actual things. They're not meant to be a stand-in or a lack of race ethnicity.
Exactly. I think, exactly. I think a lot of research that I read that has, an RC presented that, it's like, oh, we have these wide generalizable findings, and it's like,
right.
They're not quite as general, and that's okay, but it's something you have to admit and own, I think.
Yeah, great. Like, I know you have lots of thoughts about this and other things as well. Do you want to jump in? Only because we've talked about it.
Yes. Yeah, I do. Challenges abound. Let's see. I'm still a little bit in the experiential part of my thinking about when I present. So there's this sort of structural piece of the content and the challenges we run into, and the complexity of communication with any community, any audience. But also just the reality of being a person presenting. One of the challenges that I feel that I navigate is, or that I think about with presenting, is the impromptu portion of presenting. So I think Q&A is an interesting challenge. I frame that as a challenge. For some people, I'm sure it's a joy. But as somebody who, really likes to try to choose my words carefully, and also who can really like go off down a garden path of meandering, which could happen right now if I don't look at my notes, that the Q&A is like a little bit of a minefield, and also just involves, thinking on your feet. So with the Q&A, some strategies that I've learned from others include, writing down. So if I'm presenting in person, making sure I have a pen with me, or digitally, so that I can write down a question if I either need to mull it over, or so I can come back to it later to enhance the project that I'm working on. In part too, because there's a little bit of a kind of blanking out effect that can happen on stage. And so I might not remember these really excellent questions that come up, or points that people make. So I like to be ready to make sure that I can take a note if possible. And then just remembering for myself and for anyone when you're thinking of presenting, that we can say that we don't know and that we're happy to follow up when we don't know or when we're unsure. And that's a much stronger position than me meandering some response that's not even directly addressing somebody's question. So hopefully that addresses your question. I have another thought, but maybe we'll go to Nicole and the other thing I was thinking about, the reflexivity and positionality piece maybe can come out in the next portion.
Yeah, there's no shame in saying I don't know or I'm not sure. I think that's usually the smarter choice if that's truly where you stand, than to try and talk your way out of not something that you're unfamiliar with. So two things. One, sort of related to Allegra's point, is a lot of the time, like if someone brings up a point and it's really interesting, I just don't have the capacity to answer it during the Q&A. I try and find them later to follow up with them, or to actually be able to have like more than just a 30-second conversation where I'm on a stage with them. Or like if it's someone that like I'm not able to connect with, like shooting them an email afterwards to just check in about their question is also a strategy that I found useful for the challenges of Q&A, which I agree with Allegra is takes a lot of time to just practice, and I still get nervous about that portion as well. I think one of the challenges that I have experienced actually quite a bit, because I don't tend to present at conferences that have a large sort of LGBTQ presence, has been just people not realizing that this is an issue. So whether it's a poster or an oral presentation, there's not necessarily like the captive audience that you might have like you would at APHA, where, we have our own caucus. And so we have a group of people who are already like, that don't need to be convinced that this is important or that this matters. A lot of time I get comments like, oh, wow, it never occurred to me that this was an issue. I'm not quite sure I've quite figured out how to overcome that, other than like maybe trying to get more of my queer friends to go to other conferences. But I know like, especially with like posters where it's easier for people just to like walk by and sort of ignore you, that I found like just putting a lot of effort into making my posters really visually appealing has drawn a lot of people who've been like, I just came back to this poster because it looks really interesting. And then they actually spend a little bit more time at the poster versus like, we've probably all seen the posters that kind of all look the same with the same boxes that are just the same color of the school that people are at. And so I think just like trying, like putting the effort into like making it your work marketable, has been something that like I'm still working on, to especially in these spaces where I don't have the same level of like captive audience as there is at APHA.
I think I'm just going to jump in again, because why not? Mm-hmm. I think one thing Allegra mentioned, she's definitely the expert on positionality. I think one thing to consider is how do you, if you're using stock images, what stock images are you using? There's a photo of like 4 older adults that is a diverse photo that one day I'm going to write a paper on all the places that photo shows up, because it's just, I think it's important that we think about things like that. I think, often, I know our caucus is guilty of it, but we use the rainbow, everywhere. And, that isn't that, that things have changed. That's not the unique calling part of the LGBTQ community. The other thing that is, as Nicole was talking, I was reminded of is, it's been a very long time, probably 5 or 6 years now, but every now and then, I'll be doing a presentation in a non-LGBTQ space, and someone will either say something that's so troubling homophobic, or is such from a place of, I hope it's from a place of being misguided or misinformed, that it can very quickly kind of throw you for a loop. And in a lot of those environments, I have found, my initial reaction was always to engage in it. And I still want to, but sometimes it's important to say, like, well, thank you for that comment. I'd be happy to talk with you afterwards, or dispel, quickly dispel whatever they're saying, and then kind of focusing back on the work and, offering to meet with them after. Because I think we've all been in places, maybe I'm doing it right now, where, conversations get hijacked. And I think when you're presenting LGBTQ work, it's sometimes important to make sure the conversation doesn't get hijacked in a way that creates a harmful environment for people.
Mm-hmm. Yeah, that's a really great point. All of you really great points. Thank you for sharing your strategies, experiences. I am being mindful of the time. I did want to ask one last question, but I think I want to pause here and see if the audience has questions for the panelists. And maybe some of the points you were going to make about the last question will come up, and if not, I can circle back. But any audience questions, anything that resonated with you, any thoughts about what you would like to hear more of, any experiences you want to share, and feel free to do that. Feel free to unmute yourself or type in the chat. So let me just pause for a couple of seconds. Anyone feel so inclined? I should have said you could raise your hand too. Sorry, I'm forgetting Zoom functionalities. And I do know a couple of people on this. Okay, thanks, Cindy. I was going to say, I know many of you,